State of Cannabis.
This is the State of Cannabis News Digest, a roundup of this week's key developments in the cannabis industry. Our top stories.
This week, California reports another quarter of strong cannabis tax revenue, even as temporary rate changes highlight the pressure on consumers and retailers. And in Rhode Island, health officials launch a new public campaign aimed at encouraging safer use as adult consumption continues to rise. Across much of the country, the debate over hemp is intensifying. A federal change to the definition of hemp has Minnesota bracing for a nationwide ban on many hemp-derived THC products. Chicago is considering sweeping restrictions of its own, while Wisconsin lawmakers push new limits on intoxicating hemp drinks and edibles. And in Texas, regulators move in two directions at once, expanding medical cannabis access while tightening rules on youth sales of hemp-derived THC. Meanwhile, several states are at pivotal moments in their medical and adult use markets. Kentucky prepares for its first legal medical cannabis sales. Virginia readies a new plan to finally open adult use stores by late 2026. Nebraska's voter-approved medical law faces a court challenge that could test the state's initiative system. And in Maine, regulators issue another major recall tied to contamination in cannabis products, raising concerns about oversight and product safety. It's a week of expansion, restriction, uncertainty, and consumer impact, all unfolding in real time. Stay with us for the full stories, state by state, as we break down what these developments mean for patients, businesses, and the future of cannabis in America.
And now here is the deeper look at the key events in the cannabis world this week.
California's legal cannabis market continues to bring in major tax dollars for the state. According to new figures from the California Department of Tax and Fee Administration, cannabis sales generated $283 million in state tax revenue in the third quarter of 2025. That includes $176 million in cannabis excise tax and $106 million in sales tax, based on returns filed so far. During this period, the excise tax rate temporarily rose to 19%, before returning to 15% on October 1, 2025, after Governor Gavin Newsom signed AB 564. The tax structure remains stacked. The excise tax is applied first, and then sales tax is calculated on top of that amount. California's vendor compensation program also remains in effect, allowing eligible equity cannabis retailers to keep 20% of the excise tax they owe for a 12-month period. In the third quarter alone, they retained more than $1.99 million. The program began in 2023 and is scheduled to end on December 31, 2025. Since adult-use cannabis sales began in January of 2018, the state has collected more than $7.61 billion in cannabis tax revenue, including past cultivation taxes, which were eliminated in July 2022. For patients, consumers, and business owners, these numbers illustrate that California's cannabis market remains large and heavily taxed, and that policy adjustments, such as the temporary tax hike and its rollback, continue to shape what people pay and how dispensaries operate.
Rhode Island health officials are rolling out a new public awareness effort aimed at reframing how residents think about cannabis. The Department of Health has launched a $130,000 campaign called Rhode Island Responsible. Rather than attempting to reverse legalization, it highlights ongoing risks, especially for young people, drivers, and pregnant individuals. Health Director Dr. Jerome Larkin says the campaign's goal is to help people better understand those risks and promote responsible use. The effort includes fact sheets and social media content in English, Spanish, and Portuguese, and was shaped by 500 surveys of cannabis users, as well as interviews with experts. State data show that about 20% of Rhode Island adults now use cannabis, almost double the 2017 rate, and higher than the national average. Cannabis use among high school students has fallen since 2011, but nearly 1 in 3 Rhode Island high schoolers say they have tried it. With legal, regulated products widely available, officials say the message remains clear. Cannabis is legal for adults, but how, when, and by whom it is used still matters.
Minnesota's hemp THC industry is facing a new challenge from Washington. A recently signed federal spending bill changes the legal definition of hemp and will ban most hemp-derived THC products nationwide within a year, including many beverages and edibles now sold in Minnesota. Governor Tim Walz says the move is very disruptive and that the state is exploring how to respond. Minnesota has been seen as a national model for regulating hemp THC drinks and gummies, and state and federal lawmakers Tom Emmer, Amy Klobuchar, Tina Smith, and Ilhan Omar are calling for Congress to revise the law before the ban takes effect. They want a federal framework that mirrors Minnesota's, with testing standards and age limits instead of a blanket prohibition. Still, not everyone agrees. Minnesota Attorney General Keith Ellison joined dozens of attorneys general supporting the federal provisions, and Representative Andy Harris, who helped craft the language, says concerns about economic harm are desperate mistruths from an industry that stands to lose money. Meanwhile, veterans groups, parents of cannabis patients, and hemp advocates warn that the ban could wipe out businesses and limit access to products people rely on. Congress has about a year to decide whether to keep the ban or establish a new national rulebook for hemp-derived THC.
Wisconsin lawmakers are moving to rein in intoxicating hemp products such as Delta-8 gummies and THC seltzers. A bipartisan bill, Senate Bill 682, would require all hemp-derived cannabinoid products to be sold only to people 21 and older, tested by independent labs, and packaged in child-resistant, tamper-evident containers, not designed to appeal to kids. The proposal also caps THC in beverages at 10 milligrams per serving and no more than 2 servings per container. Hemp growers say the legislation is a response to a new federal ban on hemp products with more than 0.4 milligrams of THC. They argue that a strong state regulatory structure could protect local farmers and businesses that have invested heavily in the hemp market. The bill is now in the Senate Committee on Agriculture and Revenue and is competing with another proposal that would regulate intoxicating hemp products in a manner similar to alcohol.
Chicago's fast-growing hemp market may soon be reshaped by a new ordinance moving through City Hall. The City Council's Committee on License and Consumer Protection voted 10-6 to advance a proposal that would ban the sale of hemp-derived cannabinoid products by any business that is not a state-licensed cannabis dispensary. That includes smoke shops, convenience stores, breweries, and other retailers currently selling hemp-based THC or CBD products. The ordinance, sponsored by Alderman Marty Quinn, with support from Alderman Silvana Tabares, defines hemp-derived cannabinoid products broadly, covering any hemp-based item with natural or synthetic cannabinoids that can be inhaled, eaten, or applied to the skin. It also prohibits concealment, defined as hiding or blocking the discovery of those products. If the full council approves the measure, only licensed dispensaries could legally sell or possess these items in Chicago. Violations would carry $2,000 to $5,000 fines per day, and repeat offenses could result in license suspension or revocation. The rules would take effect 10 days after publication. Supporters say the crackdown is about safety. Quinn has described parts of the hemp market as shady, while Tabares points to declines in child poisoning cases and fewer 911 calls in areas where bans are already in place. They argue that with a federal hemp ban expected next November, Chicago should act now. Opponents, including local shop owners, the Illinois Healthy Alternatives Association, and the Illinois Black Hemp Association, warn the ban would crush small businesses, limit access for medical users, and concentrate sales in dispensaries, creating an effective monopoly. 7 wards have already banned hemp product sales, with 3 more considering it. Quinn says he will wait to call a full council vote until he believes he has the 26 votes needed for passage. For many Chicago consumers, the decision may determine whether they can continue buying from neighborhood shops or must turn to dispensaries for nearly everything.
Texas's slow-moving medical cannabis program saw several coordinated and at times contradictory developments this week. Regulators finalized new rules giving physicians a formal pathway to request additional qualifying conditions for the state's low-THC program. Though procedural, it could shift some authority from lawmakers to clinicians. Officials also clarified that doctors may recommend low-THC inhalation devices but are not required to, and that dispensaries can petition to introduce new devices if they attest they are safe and effective. With no explicit technical standards, that attestation becomes central to cannabis testing and oversight in Texas. Access is also expanding. The Department of Public Safety has conditionally approved 9 new dispensing organization licenses, the first stage of an expansion to 15 operators. Major multi-state companies, including Trulieve and Verano, are among the applicants. While they cannot cultivate or sell yet, clearing financial and disciplinary reviews could reshape a market that has long featured only 3 providers. The state plans to distribute licensees across public health regions to reduce travel times for patients, a persistent barrier to access. Meanwhile, lawmakers have added chronic pain, traumatic brain injury, Crohn's disease, inflammatory bowel diseases, and hospice care to qualifying conditions. For more than 127,000 existing patients, this marks a significant expansion. But even as medical access widens, the state is tightening hemp rules. Emergency regulations now prohibit the sale of intoxicating hemp products to people under 21, aligning with the governor's executive order. It underscores an ongoing tension in Texas cannabis policy, the willingness to broaden regulated medical use while drawing firm boundaries around unregulated hemp-derived THC. Lawmakers have rejected broader bans, and polling shows voters oppose them, leaving regulators to navigate a rapidly shifting gray area.
As cannabis reform continues to move forward across the country, all eyes are on Texas. And one event is leading the conversation with facts, data, and direction. The Texas Cannabis Policy Conference, presented by the Texas Cannabis Policy Center, returns January 29th through 31st at the Thompson Conference Center on the University of Texas at Austin campus. This year's theme, Maintaining Momentum for Effective Cannabis Policy, brings together lawmakers, medical professionals, researchers, entrepreneurs, and advocates to focus on what's next, from medical access and regulatory integrity to innovation, safety, and civic action. If you believe Texas deserves smart, responsible cannabis policy, this is where the dialogue begins. Registration is open now at texascannabisconference.org. Students attend free with registration. That's texascannabisconference.org, where Texas comes together to shape a responsible cannabis future.
Kentucky's medical marijuana program is finally preparing to serve patients. Governor Andy Beshear says the state's first legal medical cannabis sales should begin within the next couple of weeks, starting with a dispensary in Ohio County near Bowling Green. The governor says the rest of the system should scale up very quickly after that. Although medical marijuana became legal at the start of 2025, dispensaries have remained closed as cultivators and labs completed early harvests and testing. Beshear now says several growers have finished harvests and that products are moving through testing and quality checks, with some of the earliest batches awaiting final approval in Ohio County. Statewide, 48 dispensaries have been licensed, and nearly 24,000 Kentuckians already have electronic certifications that will allow them to buy medical cannabis as soon as sales begin. Kentucky is now one of 38 states with legal medical marijuana, and the upcoming launch will mark the first time patients can purchase these products from licensed in-state dispensaries.
Virginia is preparing to allow adults to buy cannabis legally in stores for the first time. A legislative commission has completed a proposal lawmakers will introduce in the 2026 session to create a statewide adult-use cannabis market, with legal sales targeted to begin on November 1st of 2026. The plan follows Virginia's 2021 legalization of possession and home grow, which left consumers without legal retail options. The framework eliminates local opt-outs, meaning no locality could ban cannabis stores entirely, though zoning authority remains with local governments. The bill sets a relatively low state tax and allows localities to add up to 3.5%. It also reserves up to half of all licenses for small, Virginia-based microbusinesses while capping any operator at 5 total licenses. Governor-elect Abigail Spanberger has expressed support for a regulated system that invests revenue into priorities like schools, and advocates say her backing could finally get a retail bill signed after years of vetoes. If passed, Virginia would shift from a system with legal possession, but no stores, to a fully regulated retail market with testing, labeling, and age checks.
Nebraska's medical cannabis laws, approved by voters in 2024 with strong majorities, are now tied up in a legal fight. This week, the Nebraska Supreme Court heard arguments on whether alleged fraud by a small number of petition circulators and notaries should trigger a new trial that could put thousands of petition signatures back under scrutiny. Justices questioned how such a challenge fits, now that signatures were verified more than a year ago, and the election results are already final. Supporters of the medical marijuana petitions say the lawsuit threatens Nebraska's ballot initiative process, while opponents argue they are protecting election integrity. The court is expected to issue a ruling in the coming months.
Maine's cannabis regulators have issued another recall linked to NorCO outdoor cannabis, adding new pressure on both the company and the wider market. On December 3rd, the Office of Cannabis Policy recalled several flower and pre-roll batches after tests showed unsafe levels of yeast, mold, microbials, and arsenic. These products included bulk flower and pre-rolls sold at 22 adult-use stores across Maine between October 15th and December 2nd. This recall stems from an ongoing investigation that began after a consumer reported an adverse reaction to NorCO vape cartridges. Subsequent lab results showed unsafe levels of the pesticide chlorphenapyr in certain cartridges. As regulators tested additional NorCO batches, new contamination issues emerged, prompting the broader recall. Consumers are encouraged to check batch numbers on their packaging. Affected products should be returned to retailers or disposed of, and anyone experiencing symptoms should contact a healthcare provider.
This was the State of Cannabis News Digest, available weekly. You can listen to us on all main podcast platforms. To make sure you don't miss out on the latest updates and in-depth analysis of the cannabis industry, be sure to subscribe to our podcast. By subscribing, you'll get notifications for each new episode, helping you stay informed and ahead in the ever-evolving cannabis market. Join us next Saturday for more insights. Until then, keep thriving and stay green.